Hello and welcome to a presentation on a metabolic approach to COVID-19 and post-COVID-19 syndrome. My name is Adina Dabica. I'm a licensed acupuncturist and diplomat in Oriental medicine. I've been in practice since 2008. Also, more recently, last year, 2021, I got certified in functional medicine with the American Board of Anti-Aging Medicine. I will share tonight mainly a functional medicine approach, metabolic medicine approach to COVID-19. Last year, I had an exclusive focus in a presentation on Asian medicine and COVID-19. So for those of you who are interested, I can share that information, that link, if you email me at hello@sol.center. I will write this email below the presentation, this presentation. So the objectives for tonight's presentation are to discuss the metabolic, anti-aging, and some of my favorite Asian medicine approaches to COVID-19 and post-COVID-19 syndrome, things that have worked for me, my family, and my patients, in the hope that this will help you educate yourself. I'm a big believer in educating my patients in understanding the principles of why we do certain things. So once you understand the principles, then you can select different ways. There are many ways to achieve some results. I'm just going to list a few of them that I have experienced with, and also that are backed up by peer-reviewed articles published in journals. And the reason why I decided to do this presentation is because of my second COVID-19 infection back in October this year. I went to the local urgent care to get a better test than whatever I had in the house. And when it came back positive, I was recommended to take Paxlovid, very recent antiviral, still in the experimental stage, but approved for emergency use. That was the only option I was offered. So then I started to wonder, where are they really getting their literature from? And there was nothing else mentioned. So I'm actually doing this presentation to show that we do have data. There is enough data to support different modalities that I'm going to share with you tonight. So here is my disclaimer. This presentation is for educational purposes, and it's not intended to treat COVID-19 or post-COVID-19 syndrome. Always consult with your physician. And as I said, the source of this presentation is in articles published in peer-reviewed journals. I'm a strong believer in education, and my patients know they always go home with a plan, and each supplement has an explanation, like why do we take it. So once you understand the principles, as I said, it is easier to have compliance with this plan. So let's start with some of the epidemiology of COVID-19. I included the source here of this data. So it's from the NIH website. The individuals more severely affected, requiring hospitalization and with a higher mortality rate, are males, people over the age of 60, people of Black, Hispanic, and Asian ethnic minority groups, and people with underlying medical comorbidities such as obesity, cardiovascular disease, chronic kidney disease, chronic lung disease, smokers, patients with active cancers under treatment with a weakened immune system, solid organ transplant patients, hematopoietic stem cell transplant patients. So this is the data that we have. In terms of post-COVID-19 syndrome, the picture is a bit different. So first of all, what does post-COVID-19 syndrome mean? And I'm going to come back to this definition with symptoms in the next slides. The post-COVID-19 syndrome is when, after an initial recovery from the acute stage of COVID-19, which might take from 3 to 4 days up to several weeks, we start seeing sequelae. Here are some of the risk factors: more than 5 initial symptoms and initial disease severity, old age, pre-existing comorbidities, the ones that I just listed in the previous slide, female, as opposed to the previous slide when we had male, that have more severe presentations, and pre-existing inflammation consistent with C-reactive protein, increased levels, high levels D-dimer, decreased lymphocytes count, increased levels of interleukin-6, procalcitonin, blood urea, nitrogen, and increased neutrophil count. So depending on where you look, the data on post-COVID-19 is conflicting. It varies a lot. So if you look at the CDC's website, it's only 13.3% of the population who got the COVID-19 presenting with post-COVID-19 syndrome. If you look in the clinical practice, so what the practitioners share, they see between 50 and 80% of the population developing one or more long-term symptoms. So I included the 2 sources here, one book and one systematic review and meta-analysis published in January 2021. So it is a problem. It's a serious problem, and we have to understand it so we can address it properly. So there are different classes of symptoms. There is an immune response with fever and chills, sweating, especially at night. Then we see a lot of gastrointestinal symptoms. So the virus affects the internal lining of the GI tract. So we see vomiting, nausea and diarrhea, pulmonary symptoms such as cough, wheezing, rhinorrhea, and sputum. And unfortunately, the virus creates brain inflammation. So we see all these neurological symptoms such as brain fog, altered attention span, cognitive impairment, insomnia, depression, anxiety, myalgia. And we see also cardiovascular symptoms such as chest pain, palpitations, positional orthostatic tachycardia or hypotension, and vasovagal syncope, in other words, fainting. So broad presentation, and this list is not exclusive, so it can definitely affect more. It can present with more symptoms, but this is mainly the picture. Whereas in post-COVID, some of the symptoms, of course, persist. So the fatigue persists because this is really a sign of mitochondrial dysfunction. The shortness of breath, consistent with pulmonary fibrotic changes, may develop, and the cough, wheezing, rhinorrhea, and sputum might continue, especially with a sputum that is hard to expel or with a dry cough. Then the neurological symptoms can worsen with brain fog. So everything that was mentioned before is the same, can present similarly or even more severely. Then we see hair loss. Almost every patient I treated complains of hair loss after COVID for months. Rashes, cardiomyopathy, venous and arterial thrombosis, chest pain and palpitations, and everything that I mentioned before in terms of cardiovascular symptoms, including hypotension with ascending up fast, tachycardia. So it's a lot to address. And here I have systematized. So in the long term, there is unresolved inflammation in the cardiovascular system, the pulmonary system, neurological system. There is chronic inflammation, also gut dysbiosis coming along with COVID-19. And it is really the belief of the community of anti-aging practitioners and the strong opinion that this is an autoimmune presentation. It has all the signs and symptoms of autoimmune diseases, so joint pain, headache, cognitive impairment, fatigue. So we have to adopt the main strategies that we use for all autoimmune conditions, such as cutting off the gluten or the irritants. We have to identify the allergens, fix the gut, in other words, repair the inner lining of the intestine, and maintain an anti-inflammatory regimen, including diet, herbs, and medication. Again, this is what motivated me to do this presentation, because people more famous than me famously got treated with Paxlovid, and they developed rebound COVID. So I'm not sure if rebound COVID is really the issue or just the unresolved COVID, but Paxlovid has many side effects on different systems. So I really wanted to show here that there are options and there is enough data to support whatever I'm going to share. So here is the functional medicine approach to COVID-19 and post-COVID-19. As I mentioned in the beginning, once you understand the principles, then you understand the supplements. So in the acute stage, so anywhere from day 1 to day 10, or even earlier in some cases, or later in other cases, day 14. My mother is 85 and she developed, so her acute stage lasted a little longer than mine. So mine lasted about a week. For her, it was around 2 weeks. The first approach is to decrease the viral load, along with decreasing the overall inflammation in the body and modulating the immune response. So I listed here some of the supplements that I use in my clinic successfully, and I used myself and my family. So I'm gonna go through each of them and explain their mechanism and why the authors of the articles I'm gonna mention here thought or observed that they are working. In the later stage, so if there is long COVID, so after day 10, 14, we also, in addition to continuing to work on inflammation and modulating the immune response, we have to regulate the stress response. We have to protect the heart and restore the cellular energy, because one of the main problems we see with long COVID is fatigue. So people don't have the drive, the energy to perform as they used to perform before COVID. So they get easily tired and depressed. So let's go through each of them. And I'm going to start with the artemisinin, which is my #1 go-to, thanks to my Asian medicine teacher, Dr. Steven Jakovitz, who first raised the awareness about artemisinin. So I've been using it for the past 2 years in my practice. It's an extract from Qinghao, an Asian medicine, sweet wormwood. So it was developed for helping patients with malaria to reduce the mortality rates of those patients. And the Japanese researcher who developed this extract was awarded a Nobel Prize in Medicine in 2015. So some of the mechanisms, and I included here the articles mentioning these mechanisms, are stimulating adaptive immunity via the generation of CD4 and CD8 lymphocytes, which are responsible for antibody production to target SARS-CoV-2, as well as the downregulation of cytokine production. Artemisinin and its derivatives also regulated several immune cells, such as monocytes, macrophages, T cells, and dendritic cells to prevent the release of pro-inflammatory cytokines and the subsequent cytokine storm outbreak. So cytokine storm is really an important issue when we deal with severe cases. So we have to make sure we prevent that and we decrease the chances for the body to develop that. And here is another study that was performed on 2 European SARS-CoV-2 strains, one from Germany and one from Denmark. And the authors of this study found the artemisinin-based treatment to be working. So we confirmed the efficacy of artemisinin-based treatment, and it was published in Nature. Inchaosan is a famous Asian medicine formula for what we call in Asian medicine wind heat invasion that presents with fever, sore throat, headache, among other symptoms. So this is a study in which it was revealed that some of the potential mechanisms are the TNF signaling pathway, a toll-like receptor signaling pathway, T-cell receptor signaling pathway, and MAPK signaling pathway. So the authors believe that Inchaosan is a potential candidate for treating the COVID-19. COVID-19 presents with sore throat. I actually forgot to include this symptom in my initial presentation of the symptoms. Now, going more to the functional medicine approach, I always offer the patient the advice to do neti pots to decrease the viral replication in the nose. And also, I make an oil based on iodine in my clinic, but in literature, I found this iodine nasal spray. So if you email me, if you are curious about this spray, I can tell you what that spray is. And here you have 2 references, one from the Ear, Nose and Throat Journal published in 2021, showing the efficacy of povidone iodine nasal spray and oral antiseptic preparations against SARS-CoV-2. And another one published in the JAMA. So there is evidence that iodine spray really decreases the viral load. Of course, if a patient is already supplementing with iodine, we need to discontinue the supplement for the duration of the use of the iodine spray. Zinc is a famous supplement already for flus and colds. So studies show that it does help with the prevention and treatment of SARS-CoV-2. Also, pre-existing lower zinc level might trigger the severity of the disease. So it's a good idea to measure your zinc levels and supplement if it's needed. Melatonin has also an antiviral, like a direct antiviral action. So here is the reference. It was published in 2021. And this study showed that really melatonin acts to reduce reactive oxygen species-mediated damage, cytokine-induced inflammation, and lymphopenia in viral diseases similar to COVID-19. So the conclusion provides evidence for potential benefits in melatonin use for COVID-19 as early as the day of diagnosis. We definitely know that melatonin has an anti-inflammatory action. The combination of an anti-inflammatory and antioxidative properties of melatonin offers a possible therapy for SARS-CoV-2 due to its effects on all the stages of the virus cycle: cell entry, viral replication, and deleterious downstream signaling cascades. So some of my patients might already be on it already because it's such a useful supplement for many conditions, but of course it's desirable to measure the levels before you supplement. So know your levels and be prepared. Some of the functions of melatonin are helping the immune system, acting as an antioxidant, blocking the estrogen from binding to receptor sites. That's why it's so useful in estrogen excess PMS, when some of the pathways of methylation are not working that great. It also decreases cortisol levels, balancing the stress levels, prevents cancer, improves sleep quality, improves mood, stimulates the parathyroid function. It's heart protective because it creates vasodilation, decreases inflammation, helps in stroke prevention, and many more. I couldn't list all of them here. So unfortunately, as we age, our bodies produce less melatonin. I'm going to go through a list of reasons why the body produces less melatonin and what can you do to help your body produce more. So as I mentioned, it has this antioxidative action, counteracts reactive oxygen species damage by stabilizing the inner mitochondrial membrane. Without the use of melatonin, the patient will commonly develop B12 deficiency. So make sure you have the levels, you know your levels. And this is another study showing that melatonin is a promising agent to overcome COVID-19 infection in healthy, obese, and diabetic patients. There are actually 2 studies here, so it's a very promising supplement. Some of the causes of low melatonin are foods that are high on the glycemic index, such as carbohydrates, excessive alcohol, excessive caffeine, tobacco, artificial lights exposure after 8 p.m. is big. Always dim the lights of your house after sunset. Also, turn off your Wi-Fi when you sleep. So electromagnetic fields affect the melatonin levels. Not only turn off the Wi-Fi, but protect your cell phone with a cage, a Fahrenheit cage, if possible, or turn it off at night. Aging, decreased B12 levels, and some medications such as aspirin, acetaminophen, diazepam, etc. So we use melatonin in other conditions such as hypertension, coronary heart disease, Alzheimer's, Parkinson's, stroke, brain injury, sleep disorders, insulin dysregulation, neurodegenerative diseases, anxiety, cancer, and GI diseases. So very useful. Know your levels. One of the tests that I favor is really the Dutch test. It's a simple urine test that measures many hormones, so including the melatonin levels. Propolis is a promising agent also. I love propolis sprays when there is sore throat. So it has been showed in these systematic reviews that it has beneficial effect on the viral replication. So I'm not surprised because I use it in all cases of a viral infection and flu. It's a bee product, so it's the defense of the bee against aggressors. You can also buy propolis mixed with honey, especially if you have cough. This is very beneficial. The second strategy is to decrease the inflammation. So what has been said at the beginning of the pandemic, there was this concern that non-steroidal anti-inflammatory drugs could suppress or increase the severity of SARS-CoV-2 because they would mask the symptoms, so you would feel better, and then the body wouldn't be actually doing that great, but you would feel good. So here is a systematic review and meta-analysis of 266 papers on COVID-19 and non-steroidal anti-inflammatory drugs, from which 61 mentioned ibuprofen. And this observational data did not confirm the theoretical risk of non-steroidal anti-inflammatory drugs, including ibuprofen. So I'm not a big fan of non-steroidal anti-inflammatory drugs. They are available over the counter. But in my last infection, I have to say that it was really the only thing that helped my headache. It was a very annoying headache that persisted for days. So I found relief after taking a few doses of Motrin. So it's also showing here in this study that it may be a useful adjunct therapy for patients with severe COVID-19 infection. So of course we need more clinical data always. Now, it's very important to control inflammation. So if you have a pre-existing pro-inflammatory condition, it can be anything from arthritis to obesity to an autoimmune condition. It is better to have this under control now rather than when you are sick. And actually, there are 7,000 environmental toxins that can irritate and create inflammation, and only 5% of these are tested for chemical safety. And other sources are really surgeries, vaccinations, stress, smoking, free radicals, obesity, and allergies. So all these are sources of inflammation that should be controlled now rather than tomorrow. Turmeric, echinacea, and licorice, they all have anti-inflammatory properties similar to NSAIDs. And in the anti-aging community, there is this new kid on the block, so to speak, the low-dose naltrexone. Naltrexone is a non-selective antagonist of opioid receptors that is mainly used as a rehab therapy for discharge opiate addicts to eliminate addiction and prevent relapse. So in a low dose, though, it is very useful in autoimmune diseases. This can be anything from MS to chronic fatigue, chronic pain, weight loss. What is also good to know is that the generation of free radicals is involved in systemic inflammatory response and potential cellular damage and death. So make sure the oxidation is under control with a proper diet and supplements, including glutathione. I'm going to talk about this in the future slides. Vitamin D is also famous, just as zinc is, for common cold, common flu, because of its immunomodulatory effects on the innate and adaptive immune systems. It regulates the renin, angiotensin, aldosterone system in the kidneys and the lungs, has protective effects on the endothelium, and prevents thrombosis. So this study shows that there is no downside to increasing vitamin D intake and having sensible sunlight exposure to maintain serum vitamin D levels at the level of at least 30 nanograms per milliliter, and preferably 40 to 60 to minimize the risk of COVID-19 and its severity. I don't know about you, but last spring, my vitamin D was about 25. So It's something to consider. Measure your levels, as I said. There is this correlation between the level of vitamin D and the increased risk of contracting COVID, severe COVID. So if we want to decrease the mortality rates, we should measure and make sure there is no vitamin D deficiency prior to contracting COVID-19. So in functional medicine, it is recommended that people at risk of COVID-19 and influenza consider taking 10,000 international units per day of vitamin D3 for a few weeks to rapidly raise the blood serum levels, followed by 5,000 international units a day. So really the goal is to achieve a serum level of vitamin D of 40 to 60 nanograms per milliliter. And this is the source of the study, was published in Nutrients. So the approach in functional and metabolic medicine is for adults, for every 10 nanograms that you desire to achieve, give 1,000 international units a day, if the patient has normal renal and hepatic function. So in patients with hyperparathyroidism, granulomatous diseases and cancer, we have to be careful, and we might not be able to achieve those levels without elevating also the calcium levels. So sometimes you also have to think in terms of trade-off, maybe temporary. It's a good idea to increase until the patient gets over the COVID, and then we can allow the levels to drop. So licorice is a promising herb with antiviral and immunomodulatory properties. We'll see it also mediates the stress response. So some of the actions of these herbs overlap, so they have multiple functions in our strategy. Licorice was also intensively studied in relationship with the HIV infections. So there is a lot of data already on different viruses and licorice. If the patient has high blood pressure, we have to be careful with licorice supplementation. Quercetin is a carbohydrate-free flavonoid that is the most abundant flavonoid in vegetables and fruits. When you get the infection, you might not have the chance to source it from those natural sources because just because you might not want to eat, nausea, vomiting are very common. So you might want to supplement with quercetin. So this study suggests that the use of quercetin as an anti-inflammatory, antioxidant, and analgesic compound is very useful as a potential treatment for severe inflammation in patients with COVID-19. Here are some of the foods rich in quercetin. It is good to incorporate those before you get infected. So make sure you have a balanced diet with all the colors. Glutathione is a tripeptide composed of 3 amino acids, cysteine, glutamic acid, and glycine, and it is the strongest antioxidant produced in the body. It has antiviral, anti-inflammatory, and anticoagulant properties, and it prevents the cytokine storm. To increase the production of the enzyme necessary to synthesize glutathione, supplement with curcumin and or quercetin. It is essential for the control of endogenous vitamin D biosynthesis, and it's contraindicated in people with sulfite sensitivity. So the third aspect of our acute phase strategy is immune modulation. For that purpose, it's important to supplement with B vitamins, which activate both the innate and the adaptive immune responses, reduce the pro-inflammatory cytokine levels, improve respiratory function, maintain endothelial integrity, and prevent hypercoagulability, and can reduce the length of stay in the hospital according to these 2 studies. So it is a very good support for cellular immunity and lowers the inflammation. I usually supplement with B complex twice a day. I also have to mention that not all the supplements are equal. I like pharmaceutical grade supplements. So I use a company called Molecular Products. Thorn is an excellent one. So you can do your research and see what's the best that is available on the market. And also maybe ask someone qualified. Probiotics. So there was this pilot study profiling fecal samples collected 2 or 3 times per week for the time of hospitalization until discharge. So this microbial profiling showed that there is alteration in fecal microbiota comparing to controls in patients with COVID-19, just because of the opportunistic pathogens that coexist with the COVID-19 infection. So supplementing with probiotics was considered a good idea by this study. And I included other studies showing the same thing. This study shows the same, this shows the same. So it is definitely important to supplement with fermented foods, natural probiotics, but when the time is pressing, when you have the COVID, definitely consider a probiotic. So researchers are suggesting the use of probiotics in people with COVID-19 is beneficial since probiotics reduce inflammatory cytokines and gastrointestinal symptoms. There is also this gut-lung axis. The role of probiotics in preventing viral respiratory infections is considered in all the viral cases. So in Asian medicine, for thousands of years, we knew about the relationship between earth and metal. There is this mother-son relationship. Earth generates metal. So it's part of the generative cycle. Now, recent studies confirmed what we already knew in Asian medicine, showing that there is this bidirectional interaction between the respiratory mucosa and the gut microbiota, known as gut-lung axis. So it seems like the intestinal dysbiosis is associated with increased mortality in other respiratory infections due to an exacerbated inflammation and decreased regulatory or anti-inflammatory mechanisms in the lungs and in the gut, pointing to this important relationship between both mucosal compartments. So I included 2 references on this relationship. So it is interesting how modern research confirms wisdom that is really, really very old in Asian medicine. The long COVID approach might consist in all of the above, definitely reducing inflammation and supporting the immune system, but also regulating the stress response. So licorice and melatonin from the above discussed supplements might be beneficial and instrumental for those purposes also. I like to order a salivary cortisol test. I like the Dutch test. It helps me identify the melatonin level, the cortisol level, the DHEA level. So I treat according to the results. It's always best to measure. So the patient, when they have the evidence in front of their eyes, they tend to be more compliant. We need to protect the heart, as I said. So nitokinase or natokinase, I don't know how to pronounce it, is from the Japanese natto, extract from the Japanese natto. It seems like it has a direct spike protein inhibitor, but it also prevents clot formation. So it's a promising agent in terms of COVID-19 at all stages. Yunnan Baiyao does pretty much the same thing. For centuries, it has been used to address what we call blood stagnation, so trauma, menstrual disorders, chest pain. So knowing that there is risk of thrombosis, I always recommend Yunnan Baiyao, especially if there is chest pain and other cardiovascular symptoms for my patients. Coenzyme Q10 is a must-have supplement. Myocardial damage with a consequent rise in cardiospecific troponin level is a frequent phenomenon in severe cases of COVID-19. Its causes are capillary endothelial cell dysfunction, associated carditis, low oxygenation, and increased sympathetic tone, which all worsen myocardial stiffness and microvascular dysfunction. So very useful for these reasons. Also, as an adjuvant therapy, anxiolytics are widely used. It's also helping with the mitochondrial dysfunction. So it's useful to offer the body overall energy and also to protect the heart. The virus proteins need mitochondrial energy for their own survival and replication, says this study. Upon viral infections, mitochondrial dynamics and metabolism can be modulated, which can influence the energy production in the host cells. Coenzyme Q10 is an integral component of mitochondrial respiratory chain and the key component of mitochondrial ATP production. So this is a promising supplement to increase the energy production, immunity, and decrease oxidative stress. As I said, there is some overlapping between some of the approaches that we discuss have the same supplements. For instance, here we can also talk about coenzyme Q10 when we talk about restoring cellular energy or the mitochondria. Some of the symptoms of mitochondrial dysfunction are low energy, inability to focus or brain fog, muscular pain, and symptoms depending on the type of cells of the body that are affected. Impaired mitochondrial function is associated with defects in mitochondrial performance, which include any or all of the following: mitochondrial myopathy, premature muscular aging, accumulation of glycogen and lipids, decreased mitochondria, increased DNA fragmentation, and focal areas of chronic muscle contraction. So if there is pre-existing mitochondrial dysfunction, all these symptoms will aggravate with COVID-19. Some of the symptoms of mitochondrial dysfunction are movement disorders, muscular weakness and pain, decreased muscle tone, inability to tolerate exercise, vision problems, decreased hearing, learning disabilities, developmental delays, heart, liver, renal and GI disease, stroke, lactic acidosis, dementia, and cognitive decline. So pretty much everything you don't want to see. And this is my protocol for mitochondrial dysfunction, along with some combination of mushrooms, especially reishi. So magnesium glycinate, these doses are for adults of around 160 pounds with normal renal and hepatic function. So if the patient is a heavier set, I might go higher than that. So the regular dose is between 400 and 600 milligrams per day, usually at bedtime. Coenzyme Q10, 300 to 400 milligrams, usually in the morning. Alpha-lipoic acid, 300 to 400 milligrams a day. D-ribose, 5 grams 3 times a day in between meals. NADH, 10 milligrams twice a day. And L-carnitine, 2 grams if TMAO level is normal. So this is my protocol. I use it for many conditions involving mitochondrial dysfunction. In the body, magnesium is a co-participant in 300 reactions or more. So it's really very important to know your magnesium level, because it seems that the low magnesium level advanced the transition from mild to severe COVID-19, according to this study. And magnesium sulfate infusion is suggested as an adjunctive treatment for complicated COVID-19 in this European Journal of Pharmacology. Always beneficial. NADH is a coenzyme that can stimulate energy production by replenishing depleted cellular stores of ATP. It's a strong antioxidant, mitigates DNA damage caused by oxidative stress. In conclusion, rather than choosing an approach that makes you tired, like you see here, my daughter was really tired because I made her visit a historical site in Romania, that my native Romania, that she had no interest for at that age. Rather than embracing things that really you just have to kind of say, it's gonna get better, you know, just hang in there, we'll pass. This is kind of the approach of the conventional medicine these days. And at most they give you some Paxlovid to take home. You can embrace a different perspective, right? You can find resources such as these studies, these articles, and enjoy a better outcome. And I'm just gonna leave you with this food for thought. Can you consider even a severe disease as an adventure for you to educate yourself, to progress, and to understand yourself better, and this whole experience in this body as an upgrade for a better life. Thank you very much for watching, and I wish everyone a great new year ahead. Hopefully it's going to be a normal year.